ADHD in women is probably the biggest unrecognised medical story that we have right now.
You're suffering so much, but you think, oh, well, this is what's normal.
It's ADHD that you are unable to mask at the most vulnerable points in your life.
When someone does get that test, what happens? How do you test for it?
Now, is definitely not the treatment for ADHD.
What is the catalyst that makes people come and see you because they think they've got ADHD?
So you can't become ADHD, you are.
Welcome to No Appointment Necessary. My name is Cherry Healey.
And I'm Dr. Amir Khan. I am a GP in Bradford, and you can catch Cherry and I here on this weekly podcast.
Hit subscribe, give us a follow so you never miss an episode.
And have you joined our Facebook group yet? If not, search No Appointment Necessary and join it pronto.
So this week's check-in is all about ADHD and how it presents itself, especially in women, and how a lot of women are finding they get a later diagnosis once perimenopause and menopause hits. For this episode, we have partnered with Randox Health and their Everyman, Everywoman checkup. Dr. Amir, what are those?
Well, the Randox Health Everyman and Everywoman check measures up to 150 biomarkers, giving you a complete picture on how your body's really doing. It's regular blood testing, which is one way to check for any potential risks early, and you can make changes that can support your long-term health. And they're really quick to do. And you'll get a follow-up test 6 months later so you can track your progress and see the difference your lifestyle changes are making. And for this one, there's no appointment necessary. You don't need a GP referral.
And good news, if you've got 0 patients like I do, you can get your results in just 2 hours from when the results hit the lab. And joy of joy, they've extended the code, which is NAN15, to save 15% on your Everyman or Everywoman health check until the 27th of January.
Woo, you've got plenty of time now. Book in.
Just go to randoxhealth.com. So, Dr. Amir, what is ADHD?
Well, I want to start off by saying pretty much every day at the surgery now, I am getting an appointment for someone who thinks they've got ADHD. Yes, in children, but also in adults. In fact, quite a lot of adults in their 30s, 40s and 50s are coming in because they think they've got ADHD. And I'll be honest with you, Cherry, I start every one of those appointments with an apology because I know how long that wait time is from when I give that referral to wherever it is that they want to be referred to. It's one of the hardest consultations I do, actually, and it's happening every single day.
Why is it so hard for you? Because you know that wait is coming for them.
Well, I know that they've struggled up until this point and often been misdiagnosed, mislabeled, or not diagnosed at all. And so now they can identify with a condition. They then have to wait years again to get a diagnosis and then longer for treatment and support as well. So it's as a doctor, where you just want to make someone feel better, heard, understood, it is a really difficult consultation.
I know that it's been around for a while, but I feel like recently it's become a huge topic. What exactly is it? What is going on in the brain and body?
Yeah. So ADHD is attention deficit hyperactivity disorder. And it's a difference, and note I say difference and not an abnormality, a difference in the brain chemicals inside of people who have ADHD in their brains, essentially. And what those brain chemicals do is govern the way the brain regulates emotion, focus and attention, but also kind of mood as well. So all of those things are governed by these brain chemicals in all of our brains, but theirs are slightly different and underactive in a way. The reason why it feels that there are more people with ADHD now is because we are better at recognizing it and recognizing the symptoms, and we're getting better at not misdiagnosing it as depression, anxiety, stress, all of those kind of things as well.
How do you know that you have got ADHD? What are the signs that you might have it and you should go and see a doctor?
Well, people generally present differently depending on who they are. So we know the typical kind of ADHD symptom checklist that people have in their heads are generally apply to boys or men. And that is the focus is on the hyperactivity there. So They have less of a focus and an attention on things. They're easily distracted, fidget a lot, go off on tangents. It's that typical kind of disruptive behaviour. And that word disruptive sounds very negative. It's because it's not being managed properly. In girls and women, it's very different. And this is where the misdiagnosis comes in. So with young girls in particular, they end up being called daydreamers. It's the inattentiveness that really they focus on rather than the hyperactivity. So they could be chatty girls or daydreamers or just not paying attention to things that are going on around them. Disorganized as well is often what they're called. But what girls are better at than boys is masking their symptoms. And what that means is they hide their symptoms and they kind of put them away, because what girls are better at than boys, again, is copying and mimicking what they think is normal behavior from other people. So they can come across as organized to a degree, but just imagine how exhausting that masking is, which is why girls and women are at risk of burnout, anxiety as a result. And then they just get told, you've got anxiety, here's some medication for anxiety, and it gets misdiagnosed.
It's a bit like a duck that looks like it's all calm on the surface, and then underneath it's like paddling really hard and it's just exhausted.
That's
going
the
against
best
the
description.
Thank you so much here for the metaphors. The problem is that everyone has lapses in concentration.
Yeah.
It's how does someone know the difference between just a normal lack of concentration and I really need help?
Yeah, that's a good question, because some people will say to me, oh, I'm a little bit ADHD. And that is quite dismissive. And I have to be honest with you, GPs don't diagnose people with ADHD. We can say you sound like you have it, and then I will do a referral to a psychiatrist who will then make the diagnosis. Kind of things that I look for when I'm talking to patients about whether they may have ADHD or not. It's like you say, we can all be a little bit inattentive. We can all lose our focus at times. But what ADHD is all the time. And so it affects your work, it affects your sleep, it affects your relationship with other people, it affects all aspects of your life. And what it feels like inside your head is racing thoughts, almost like a picture book flipping over and over with different pictures and different thoughts coming in all the time. And then you might be hyper-focused on something, really focused on it, and then you just have no ability to focus on anything else. And it's really overwhelming inside of an ADHD brain.
Is it a bad thing?
No, it's not. It's a different thing. The reason why we call it neurodivergent is because it's just not what has long been considered normal. But what has long been considered normal is just what we call neurotypical, what most people are. But what most people are doesn't mean if you're not that, it doesn't mean you're bad. So the key word here is difference. So they're not abnormal, they are different. And society hasn't kept up with that difference. I think that's also important. But what's going on in their brain is a difference of specific neurotransmitters or brain chemicals. And they are dopamine and noradrenaline. Now, what these neurotransmitters do in our brain are help with motivation and reward, impulsivity, emotional well-being and response to things, and focus and attention. And what we've seen in the brains of those living with ADHD is that their dopamine signaling in particular is underactive. So they need more of a stimulus to get the same reaction or reward or pleasurable feeling that you and I might get from something much, much less. So it takes a lot more for their brain to be stimulated, which is why they're always looking for other things, because whatever's happening isn't stimulating their brain enough.
Is there a connection between ADHD and addiction?
So people with ADHD are at increased risk of addiction, which is why managing ADHD is really important, because it can open the floodgates to addictions.
I totally understand about neurodivergence being different. It's not that it's bad, it's just different. So why would you take medication for something, especially if did people learn to live with it?
It's not that they learn to live with it. It's society hasn't kept up with those differences. So living in a neurotypical world is very hard if you're neurodivergent. And yes, we should all make adjustments for people who are neurodivergent. Reasonable adjustments is something we should all be doing all of the time for anyone and everyone. But what ADHD does is negatively, and it can be negatively, affect how your schooling is. Because if you can't focus on what's being taught, that will have a negative impact on your grades at school, which then has a negative impact on your job prospects, depending on what you want to do. And it's the same with work. You know, if you can't focus on the job in hand, again, it's really hard to keep a job. And lots of people with ADHD who aren't managing it well find it difficult to hold down a job. So that is why the diagnosis is important, because you can then recognize the symptoms, and then you can talk to your employer or your school or whatever and say, right, this is what I've got. And this is the adjustments I need. And then you can talk about medication, whether that is right for you or not. And that will depend on your individual circumstance.
I'm going to say something really controversial, but I've heard people say, oh, it's really annoying someone's using ADHD as an excuse to have not handed in their report, or they always turn up late.
Yeah.
How do you balance that as someone who's kind of on the receiving end of that?
I think that must be really hard. And I don't think that is controversial. I think lots of our listeners, whether they've got ADHD, know someone with it, or just know of it, will have experienced an eye roll moment, you know, when someone says, oh, I think I may have ADHD or I have got ADHD. And it's because we're getting so much better at recognizing it and it's becoming more common, people just roll their eyes and go, oh, God, here we go again. And that is terrible. That's terrible for those living with ADHD. You would only say that if you don't know what it feels like to live with it.
I think the reality is that if you've got ADHD and you get that diagnosis and then you get medication, it's life-changing, and many of my friends have been on that journey. But there's always going to be someone who makes a joke and says, oh, you know, I was late today because I've got ADHD, or, you know, it's just easy to band around. And I would find that so incredibly frustrating.
Yeah, you would never do that for any other condition. And I don't want to say ADHD is an illness, it's a difference, but you wouldn't do it for anything else that people might be taking medication for, would you? You just wouldn't.
I think it's not something to band around.
No.
Willy-nilly.
Definitely not.
Does it present more in women or men, or is it equal?
We recognise it in boys and men because they present with what we have always thought of as the typical symptoms of ADHD. And remember, as with anything in medicine, a lot of the research is done on boys and men. So the symptoms that we always have in the forefront of our mind are those that boys and men present with, and we just applied them to women. And because women present differently, we thought, oh, well, then there's a lot less women who have ADHD, but women present differently. They have all of that masking going on. They're really good at hiding their symptoms.
A tale as old as time.
Yes, totally.
Women are not men. We are not small men. We're physiologically really different. So we present with ADHD really differently.
You present with it differently, and then it changes at every aspect of your life.
What?
Yes, because estrogen, women's hormones, and to a lesser degree progesterone, have an impact on how your ADHD is. And think about that, Cherry, because your estrogen levels, if you're a menstruating lady, will change every month. You know, it will peak for the first half of your period and then drop for the second half. If you're pregnant, you've got huge levels of estrogen. If you're in the menopause, you've got lower levels of estrogen.
Amir, it's a wild ride being a woman. It is a wild ride. You never know what Tuesday is going to bring.
No.
So why does estrogen affect ADHD?
So let's go back to what ADHD is. So you've got those differences in neurochemicals, dopamine and noradrenaline. Now,
what's noradrenaline?
Noradrenaline is another brain chemical that helps to a lesser degree. Dopamine is the big one, but helps with emotional well-being, impulsivity, hyperactivity. It helps regulate your feelings and the way you react to things. Dopamine is the big one, particularly with motivation and reward and your ability to focus. Now, what estrogen does is positively reinforce the signaling pathway in your brain of dopamine. So basically, it helps. Yeah, you need to
break that one down a bit. Yeah. Hang on. Again?
Estrogen helps dopamine work.
Thank you.
Yeah.
Back in the room.
Back in the room.
Estrogen helps dopamine work. And your reward chemical.
So when dopamine is working better, your motivation and reward systems are working better, your impulsivity responses are working better, and your emotional regulation is working better. Now, what women might find who have ADHD, if they're menstruating, is because for the first 2 weeks of your period cycle, your estrogen levels are higher. So you become better at masking or managing your symptoms of ADHD because all that estrogen is helping that dopamine. Then you head into your period and you start bleeding. And at that moment anyway, you might suffer from period mood issues. And at the same time, your ADHD, because that estrogen cushion has been removed, your ADHD symptoms hit harder as well.
So someone who suffers from ADHD will have a much, much more acute menstrual cycle. Those moods will be they'll feel that much more.
They will feel their ADHD symptoms coming back much harder.
But because we all talk about how mood changes, again, maybe a woman will think, oh, that's just normal. That's just how it's supposed to be.
And they'll go to the doctor and they'll be told they've got PMS.
They'll get told to go home and have a hot bath.
But it doesn't stop there, Cherry, because let's talk about pregnancy. So if you've got ADHD and you're pregnant, your estrogen levels really go up in pregnancy, and you may well manage the pregnancy itself really well in terms of your ADHD symptoms. Then you have the baby, quite possibly the most difficult time of a lady's life. She's just
challenging.
you've given birth, you're at risk of postnatal depression already. You're tired, you're anxious, and your estrogen levels plummet at the same time.
Fabulous.
And your ADHD symptoms just skyrocket. So imagine that all the way through that kind of perinatal period.
Especially if you don't know that you have it, with so many women are undiagnosed.
Yep.
You must think, and people go, oh, well, pregnancy is hard. I mean, I just did it. But you're suffering so much, but you think, oh, well, this is what's normal. But I so much, how can people cope with this?
Well, not enough doctors know that either. Not enough clinicians know that. And not enough people know it to recognise it, actually. The second half of my period, when I give birth to my baby, these are the hotspots for ADHD. And then there's the other big one, isn't there? The menopause.
Dun, dun, dun.
Yes. So with the menopause, of course, estrogen levels drop again. You've got the perimenopause period, where it's very erratic up and down. So your ADHD symptoms, if they're not managed well, will be erratic as well.
Right.
And then you hit the menopause, your estrogen levels really significantly drop and masking becomes almost impossible.
Right.
But because the symptoms of ADHD can overlap with the symptoms of menopause, irritability, low mood, brain fog, all of those are also symptoms of ADHD. And so you get told, actually, this is just the menopause. So at those 3 points in a woman's life, they all get told, oh, it's just your hormones. It's not your hormones. It's your brain chemicals. It's ADHD that you are unable to mask at the most vulnerable points in your life.
But I do understand why it's so hard to diagnose because it could be a number of different things.
Yeah.
And you don't know what's normal. If you're just living your life, there's no way to compare, well, this person has more focus than I do. You don't know. You can't see inside someone's brain. So I can understand why it's so difficult to diagnose.
Yeah, definitely.
But ideally, you want to catch it early so a woman throughout her life, when she's met with these vulnerable moments, is able to understand why she's suffering so much.
So the current way a diagnosis is made is through a series of questions that people get asked. And what you're looking for is symptoms of ADHD, whether that's the hyperactivity stuff, whether it's the fidgety, whether it's the focus, whether it is the daydreaming and the lack of attention in all aspects of your life. So it's no good for a child, let's say, for the teacher to say, oh, well, they don't focus in class, but at home, they're perfectly fine. That probably isn't ADHD. You're looking for it at school, at home, on the way to school, on holidays. All of those things combined is when you know. And it's the same with adults. It's not just in a particular environment, because we might be different at work to what we are at home or wherever we are. So you're looking for all those symptoms in all the environments that you're in.
Sofa Cherry is very different from work Cherry. When someone does finally get that consultation, does get that test, what happens? How do you test for it?
So again, the psychiatrist or the ADHD specialist nurse, it could be, will ask those questions. Tell me about tell me about your attention and focus. Do you find yourself losing focus? Do you find yourself fidgeting in a room? Can you hold a conversation to the end? Do you have to change topics? Are you hyper-focused on things? Do you feel anxious in certain situations because you know you're going to feel like this? So there's a whole series of questions that they will get asked. And first of all, the patient themselves or the person themselves will have to fill out the questionnaire beforehand, and then the psychiatrist or the nurse will go through it with them and look at whether their symptoms are in keeping with ADHD. I'll be honest with you, Cherry, most people who get past that initial stage of the GP who goes, actually, this looks like ADHD and get referred on, do get diagnosed with ADHD.
Because we're all busy. And I think to have got to the stage where you are so worried about it, you've gone to the GP and you've had that tremendous wait.
Yeah.
It's because you know something's not right.
You know something's not right. But just having that diagnosis is a huge weight lifted off your shoulders.
Why?
Because you've been living in a neurotypical world with a neurodivergent brain. And that is really hard. You're trying to manage everyone else's expectations when you feel differently. And you're just living in a completely different world that's not geared up to you and your brain.
Have you ever thought that you were ADHD?
No, I haven't, to be honest, because I see people with ADHD all the time, and I know I don't have those symptoms. When I'm at work, my mind does kind of flip from thing to thing, whether it's a patient consultation or whether it's hospital letters, bloods, whether it's TV stuff, whether I have to get ready for this and that and the other. So it can feel like I'm going through a process of my brain just kind of thinking of different things. The minute I get home, that stops happening.
Right.
So I know I haven't got it.
Absolutely. I do get told quite a bit that people think that I have it, but nothing that you've said today kind of resonates. And I can see why people say that. But when I get home, I'm completely relaxed and I can just, it doesn't feel like it.
I think people tell you have it because they have in their mind an idea of what they think ADHD is, which is the hyperactivity
right,
side
and when I'm
of
at
it.
work, I'm excited and there's people and I'm talking quickly and, that's kind of part of the job.
Yeah, but they don't think about the attention deficit part of it because you don't show any signs of attention deficit. You don't daydream. You don't kind of not listen. You're very attentive when we're talking.
What medication can someone take for ADHD?
So I think medication is really important. You have to have a detailed conversation with your specialist to see whether medication is going to be helpful for you or not. For the vast majority of people, it is. And it's a drug usually called methylphenidate, which people might know as Ritalin. So what it does is, remember, with ADHD, your dopamine pathway isn't as strong as it should be. And so what these drugs do is stop the breakdown of dopamine in your brain. So you end up over time with higher levels of dopamine. So that pathway gets stronger. And so people can focus better. Their attention spans are better. What we see, particularly in America, and it does happen here, is people without ADHD taking Ritalin because they think it's going to help them focus better or get more creative, and they use it recreationally. I know.
I've heard this.
Yes.
People passing around at parties.
Yes. And it's...
So it's a thing.
It's a thing.
Glass of Chardonnay and a bit of Ritalin.
Yeah. It is such a bad idea.
What does it do?
A bad idea. Well, it increases your dopamine levels, and for what people think it does is improve focus and creativity. It can actually have the opposite effect. If you haven't got an ADHD brain, you do not need something to increase your dopamine levels. It's a bit like anything. If you're not deficient in something, or if something's working fine, you don't need something to make it work fine or get it up to normal levels. It's crazy, and it can cause problems with creativity. It can actually cause problems with focus and sleep and give you headaches and cause problems with your stomach as well, and nausea, vomiting. Just don't do it. If you don't need it, you don't need it.
So how would Ritalin make you feel if you had ADHD?
Because it's correcting a neuroatypical pathway, so that dopamine pathway that I keep referring to, where you are less sensitive to your dopamine, it increases the amount of dopamine, so that threshold that it requires for you to be sensitive to is eventually reached. So your motivation and reward system works better. Your focus and activity levels become in line with what is expected in a normal society. I have to phrase it like that.
Can you give me an example of like, I'm just living my life. I'm Susan. I'm just living my life.
Yeah.
Give me a really solid example of like, I'm in the kitchen. What's life like before and after Ritalin?
So it may be that you get overwhelmed with the tasks you have to do in that kitchen. So let's say you have to cook a meal and you've got different ingredients you have to get out of the cupboard. That in itself might just feel really overwhelming. And after dinner, you've got to get the kids ready for bed. That's overwhelming. And after that, you've got to prepare for work the next day. You've got this list of tasks that just feel just insurmountable.
But you're masking, so you're pretending you're fine, but actually inside you're stressed, you're anxious. It's too much. It's too much.
So what Ritalin does is bring that focus and that attention to you so you can become more organised. It doesn't overwhelm you, those lists of tasks. And you can actually start a task and finish a task, which is really hard for people who have ADHD.
Oh, it must be a breath of fresh air.
Yeah.
I have to say, I know that it's a breath of fresh air. One of my friends has suffered from ADHD and she's on medication and she says it just stops the noise.
Yeah. Mental noise, that's what they refer to it as, that flicking of thought and thought and thought and thought is called mental noise. So for you and I, coming down here, sitting down, having a glass of water feels quite nice. And we get a little bit of a dopamine hit from seeing each other.
All of those, a
big dopamine
to the moon after this.
But for people living with ADHD, they have to go hard to get a reward like that, which is why addiction is such a risk for them. So gambling, alcohol, drugs, all of those things that give you an immediate big hit, their dopamine levels rise to a point that ours would from other things, and they just think, right, I need more and more and more of that.
So you and I might go for a walk, have a lovely chat, put a nice top on and just get lots of lovely dopamine all the way through the day.
Yeah.
And that suffice.
Yeah.
But if you've got ADHD, you might need more food or more alcohol, more of a hit of something big. And so you're going to search for that.
Yeah, totally. That's exactly right. And that you need that hyperstimulation to get that reward feeling.
If you start on Ritalin and you have positive results, can you be on that drug for the rest of your life?
Yes, you can. We've got to remember that, it's still a relatively newish drug. We've got people on it for quite a number of years. But what we've seen when we started in children is their school, I don't want to say behaviour, but their school results and their ability to work and focus on schoolwork, which is so important, isn't it, improves. And so they need it as they get older to university or whatever job they're going into. And so it helps them. And so we would never take it off, because the one thing we haven't said in this really is ADHD is something you're born with. It's not something that you develop later on. So you can't become ADHD. You are born with it. Those neurochemical differences are there at birth. So anyone who says, oh, he became ADHD after this or after that, or he took this and then he became, is bollocks. I'm allowed to say bollocks?
I've never heard you swear.
You haven't hung out with me enough.
Watching Santa Claus streak at a football match. I don't know what to do with myself.
I can't say this loud enough. You are born with ADHD. You don't develop it later.
It's bollocks.
Yes.
So because estrogen becomes lower during menopause and perimenopause, do you find that more women present with ADHD at that time because it's been missed?
So they present with symptoms of ADHD. Often they get told it's the menopause. But yes, that masking becomes really difficult. And then when we talk to them about ADHD and actually look back at their lives, it becomes very clear that they had ADHD since the minute they were born, but, when they could remember their symptoms. And we talk about things like periods and we talk about things like pregnancy, and then it's like a light bulb moment. Right. Actually, all those moments there, I was better here, I was worse there, it all becomes really clear. So I'm really hoping there's people listening to this today who will go, oh my God, for the first 2 weeks of my period, I do feel better, but for the second part, those symptoms come back. Oh my God, when I was pregnant, I felt great. And then I had the baby and it was awful. And they said I had postnatal depression, but actually this is how I'm feeling. And now I'm menopausal and this is how I'm feeling.
I wonder how many women out there are still undiagnosed because they then take HRT, they take estrogen and they go back into the cycle and they're masking again.
HRT is interesting because estrogen helps with that dopamine pathway. Now, HRT is definitely not the treatment for ADHD. But what we find when we put women on HRT is that they can notice an improvement in their ADHD symptoms. Now, the important thing to say about HRT is that you are not replacing the estrogen to a premenstrual level, when it's at its peak in your body, in your younger years. You're probably replacing about between 25 and 50% of it to that level.
I didn't know that.
Yeah, you're not replacing all your estrogen.
Why not? Give me all of it.
Well, it's a balancing act.
Don't be stingy. Hook a girl up.
Well, some people do need higher doses, but remember, it's a balancing act, risk benefit with anything. So HRT is safe. I want to make sure that that's clear. But we try and manage your symptoms on the lowest doses possible, but people do notice an improvement in their ADHD symptoms. It's still not recognised treatment for ADHD.
What is the catalyst that makes people come and see you because they think they've got ADHD?
Interestingly, it's different for men and women. For men, they come and see me because they've lost their job on a number of occasions. And it's the identification of not being able to hold down a job for very long because they can't focus that brings them in. Because women are really good at masking, that doesn't necessarily happen to them. But what we see with women is relationship breakdowns, probably around the menopause. And then they recognise, actually, these symptoms have been there all along. And now all that mental noise I used to have, that I used to just kind of push right down, have come to the forefront, and I can't push it down because that estrogen net has been removed. So it's two very, very different things.
Is ADHD becoming more common, and why are we talking about it so much at the moment?
ADHD has always been there, always, but we're better at recognising it now as an issue, as something that needs to be diagnosed and managed. So that is why we are talking about it more. But I do think that ADHD in women is probably the biggest unrecognised medical condition or medical story that we have right now.
What can you do in terms of lifestyle to ease symptoms if that's what you want?
So there are things that can help. So there is no such thing as an ADHD diet. But what we know is that high ultra-processed and sugary food that spike insulin can make ADHD symptoms worse. That up and down of insulin and blood sugars in particular can make your ADHD symptoms worse. So you're better off in terms of food focusing on protein and fibre. Now, the biggest thing that people can do lifestyle-wise to help manage their ADHD symptoms is exercise, because exercise makes you produce more dopamine, and that's what we're aiming for. So regular exercise is key, and regular sleep. Sleep is the other thing that helps balance brain chemicals. So having a good sleep routine is really key too.
So it's the holy trinity again: great sleep, exercise, and a good diet.
Yeah.
How does ADHD and burnout and managing relationships, how do those things link?
So masking in ADHD, I can't stress this enough, is absolutely exhausting. You are managing day-to-day life with a neurodivergent brain, and you've got living in a neurotypical world, and you're hiding, pushing down your symptoms. Eventually, that will lead to burnout. And what burnout feels like is being absolutely overwhelmed with day-to-day tasks that you would have normally been okay with, and just poor motivation to do anything as well because it just feels impossible. And that includes relationships, because of course relationships are a good thing, but they're also work.
They require a lot from you, and commitment and showing up and presence.
And compromise.
But a lot of thought time.
Yep. And all of that compromise, all of that management of that relationship, that where things you may have just let slip by or ignored becomes too overwhelming. So you may then, your mood may be different with that person. The way you talk to them might be different. And they are so used to you masking it that they don't know how to cope with it. And you don't have this diagnosis of ADHD either. And so all of that just makes them think, you've changed. I don't want to be with you anymore. But the person suffering can't understand why it's happening either. It must be so hard.
So that diagnosis is life-changing for someone.
Yeah.
We've actually had a question in from Emma, who's got a 24-year-old son with ADHD, and he gets really terrible rages, which really affect her and her family. How can she best support him? And also, how does she cope with it? I really feel for her. That's a very challenging situation.
It's really difficult. If he is still getting into those rages despite him being on medication, he may be on the wrong dose. So it'll be worth speaking to him and getting an appointment with his specialist to see if his medication needs starting or adjusting. The other thing to do is, in your own thoughts, think this is not his behaviour, this is his brain, and it's outside of his control. And just kind of having that clear line in your head and understanding that, I think is really important. And trying to tell him, you need to do this and you need to do this and you need to do this, can feel really overwhelming. People with ADHD get overwhelmed very, very quickly. They can't cope with lots of instructions, lots of tasks and lots of expectations all that well. And the other thing to do is help them with tasks if they need it. So give them one thing at a time, wait for them to finish it before you give them anything else to do. And it's working alongside them. That compassion, that clear instruction, that kindness that is needed with them, I think really makes a difference. But it is hard. It is hard. You can get frustrated really quickly with the way you feel they're behaving. But just remember, it's their brain and not their behaviour.
We are going to be answering your questions in Chat GP in a moment. But first, let us tell you about Polytar. It's the UK's original medicated scalp shampoo, trusted by doctors, GPs, as we do have one here, for over 60 years. And Dr. Amir, you prescribe it too.
I do. I have prescribed it for my patients with psoriasis, seborrheic dermatitis, and dandruff, actually. And it contains 4% coal tar. It helps soothe irritation, reduce flaking, and treat the cause, not just mask the symptoms. And it's worth saying, you don't need it on a prescription. You can actually buy it over the counter as well. So if your scalp is irritated, flaky, or sore, it might not just be you. It could be the water that you're using as well, because hard water creates those kind of symptoms. So there are things that can help.
So Polytar say you can read a hard water hair report at polytar.co.uk to find out what's going on in your taps. And for our listeners, you get 10% off with the code appointment10. It's your favourite time of the show.
Oh, okay.
Chat GP, baby.
I was in a really lulled, calm mood, and now I'm not.
Here we go.
Come on, hit me.
One of these is really complicated and involves lots of technical words. Okay. Amanda from Warrington says she loves how supportive you are and how caring you come across. She wants to know how patients can encourage their own GP to take notice when they feel their concerns are being brushed aside. There was a recent study and it said that 85% of women didn't feel listened to by their GPs.
Yeah.
Not everyone's an Amir, unfortunately. Can we clone you?
Well, I am training other GPs as well,
Yay!
so hopefully
and
there'll
many
be some.
are wonderful. Yeah. So many are wonderful.
True. So what GPs are supposed to ask you are about your ideas, expectations and concerns when you go into a consultation. So that is, what are you worried about? What are you hoping to get out of this consultation? So my advice would be, write that down before you go. So if your GP doesn't ask you, because they may not, just say, well, I call it ICE, ideas, concerns, expectations. And so you write down what you think it might be, what you're worried it might be, because some people go, I think I've got a headache because I'm stressed, but I'm concerned it could be a brain tumour. And my expectations are either you reassure me or you send me for a scan. And so if you write it like that, ICE, my ideas, my concerns, my expectations, and every GP, I promise you, will understand that acronym ICE. You can go, well, I've written my ICE down. Then they will go, okay. And it will help them negotiate a management plan that involves you.
I love that proactive approach. And it's very empowering to have a bit of control.
Yeah.
Because GPs are hugely time poor
Yeah.
and human beings and going through their own things.
Totally.
So if you can do something that creates a positive framework for that meeting.
Yes.
It's a very short period of time.
Yeah.
That's very useful.
It is.
Have you got a health hack this week?
I'm going to repeat the one I just said, ICE. So when you go to your doctors, write down on a piece of paper your ideas, what you think it is, your concerns, what you're most worried about, and then your expectations, what you hope to get out of that consultation.
Can I add to that, like icing on a cake? You can also ask to see a different GP if you're not being listened to.
You can.
And you can also take someone with you who is able to advocate on your behalf.
Yes, I love that when people come in and they're a double act and they say, well, I think it's this and I want to this, because it helps us all get on the same page. Right. It doesn't feel intimidating at all for me as a doctor. I want to know exactly what they're thinking, what they're worried about and what they want me to do so I can then work with them.
Sadly, that's all we've got time for on No Appointment Necessary, but we absolutely love hearing from you. If you want to get in touch, all the information is in the show notes.
See you next week, and remember, no appointment necessary.